And the 31st is an international day to mention. But there's two resource fairs and walks that are coming up shortly. We've been talking about this on the radio now for a week or two, just so folks have got a good idea of what's going on and some things to keep in mind. Abe and Jamie are here with us this morning. Good morning to you.
Good morning.
Thanks for coming on here. And August is Overdose Awareness Month in Mason County. The end of the month, the 31st, is International Overdose Awareness Day. And as we've been talking about this and learning a little bit more about it, amazing to think the leading cause of accidental death here in the U.S., 5th overall. And, of course, no community is immune, including here in Mason County. So we've put together some times and opportunities for folks to get together, learn a little bit more, try to reduce the stigma a bit. And the first one is coming up on Wednesday, the 28th. Abe, tell us a little bit more about this.
Yeah, so we've put together a couple events. Obviously, the Board of Health and County Commissioners made August Overdose Awareness Month, so we're really excited about that, leading up to these two events. The origins of the events kind of happened a couple years ago, and I'll let Jamie talk just a little bit about that. But this year, we're holding our third Shelton event, and it'll be our first Belfair event. On Wednesday the 28th in Belfair at the North Mason Timberland Library. We'll have a resource fair from 4 to 5:30, and then 5:45 we'll kind of gather as a group. There'll be some people to say some words, County Commissioner, Fire Chief Bo Bakken, and some people with experience will say some words, have a moment of silence, and then we'll go for a walk. And then on Thursday here in Shelton, the same timing, 4 to 5:30 for the resource fair. Gather at 5:45. Commissioner Schuette's going to say some words. We got some people with lived experience there as well. We'll have a moment of silence, and then we'll go for a walk as well. But I'd love for Jamie to kind of share kind of the origins of the gatherings and whatnot just a couple of years ago.
Yeah, please.
Sure. So 3 years ago, it was about a week before the 31st. The 30th is my birthday. And I started thinking about it. My brother had died of a drug overdose in 2012 at 24 years old. And I just randomly Googled Overdose Awareness Day. I wanted to see if there was one. And it showed up that it was August 31st was International Overdose Awareness Day. So I sent Abe a message, and I asked Abe what he thought about doing an overdose awareness walk. So we posted something on Facebook about a week before that, and surprisingly, about 25 people showed up.
Wow, that's great.
So the next year, we planned it out about 30 days in advance, and we had over 100 people show up last year. About 100, 120 people show up. So this year, we started planning it in February. And we incorporated the resource fair portion to it. And this year, we have about 20 resources that are going to be there, ranging from treatment centers. I think we have food resources there. We have medical, just a whole bunch of really cool resources.
You are a chemical dependency counselor, and kind of in a broad over sense, without getting too specific, obviously, on case-by-case basis. When you talk with folks who have this dependency, what are some of either the ways they wish they could have early on found additional help, or what are some ways that they're able to, with your help as a counselor, push through and try to move past these dependencies?
Well, I would say that the first thing is it starts at a real community basis. A lot of people who are struggling with addiction, they don't feel that they have compassion coming from the community or anybody. They're just labeled as a drug addict. So they've lost that sense of hope. So I think just bringing compassion back into it and bringing hope back into it and letting somebody see that's struggling, that people care at these kind of events, that definitely starts the step one of being able to reach out and wanting to reach out for help.
I'm seeing a story in the Wall Street Journal yesterday. Two drug makers, this is in Ohio, looking at closing in on opioid settlements for millions of dollars. And a lot of people have to understand with the opioid crisis that people make it out like, it's a choice to be, drug addicted and stuff. These people were put on pain medicines by doctors because, and I'm getting a little political here, a lot of the pharmaceuticals reassured the medical community, reassured patients, you will not get addicted to these medicines. And sure enough, we have people misusing these medicines because they are highly addictive. My son had his wisdom teeth out, and the doctors wouldn't even give him pain medicine. They're so afraid after seeing what's happened now. We've opened these doors of just handing out these medicines like candy to a lot of patients, and I don't know. I think the pharmaceuticals have a lot to be accountable for. What are your thoughts on that? And this is something that when I was growing up, we didn't have this crisis, and it seems like I'm looking at the government's website, the federal government says this is like a late 90s phenomenon to the present where these companies reassured the medical community that it was safe to give these medicines out.
Yeah. Unfortunately, we find ourselves in quite the predicament, and a lot of things, kind of come back to that almighty dollar. The money drives a lot of where we find ourselves. So, what? I think I've shared this before. I'm hoping that at least some of those monies, after some of the settlements do go through, find their ways to communities like ours, and lend themselves to supporting programs and events like we're supporting right now, and provide opportunities for treatment and recovery.
What do you know about the different communities? We've got very affluent parts of Mason County and very poor parts of Mason County as well, and it really does. It goes through all spectrums of folks, and it may be your next door neighbor. We were talking a little bit about this last week, and oftentimes nowadays people get home from a long day's work. They've got their own stresses in lives, and they'll shut the garage door, and they won't really even interact with their neighbors in a real sense anymore. And that's kind of, with that kind of outreach and the kind of just, hey, how you doing? Maybe these are some ways that folks are able to just realize that community is there and people are there to hear from them.
Yeah, I think, Jamie mentioned earlier, a lot of times when a person finds themselves, addicted to substances or dealing with substance use disorder, they lose that connection. And so we're hoping that this event, provides the opportunity for fellowship, provides an opportunity for people to know that they're not alone. And not just for folks that are dealing with substance use disorder, or for people that may not be directed by a family member, but it's an opportunity for even just community members to be a part of. And it's oftentimes it's an issue that's difficult to deal with and talk about. So we want to bring it to the forefront. We want to try and reduce a lot of the stigma around this issue and start a conversation.
Jamie, were you surprised that with just a week's notice you had 25 people to be a part of this, to just kind of show how impactful this problem is in our community?
Yeah, absolutely. So I did this mostly because around the 30th, my birthday, it was my brother's favorite time of the year. He loved my birthday. And so when I showed up actually that year, it was the old Red Apple that everybody met up at.
Okay.
And I actually had to drive around the block one time because I started to cry, just seeing that many people that were also affected by overdose and addiction.
And then over 100 after the next year with a little bit more notice, and likely get even more upcoming this year with 2 opportunities to do this in Belfair for the first time at the library, Wednesday the 28th. It'll have the resource fair and the walk, and then here in Shelton the next day, the 29th at 4. That's at Kneeland Park. So you can get more information. You can always call the offices at 427-9670, extension 400. Or if you're not quite ready to talk with someone in person, you can always go to healthymasoncounty.com and find information there. Well, Jamie, it was nice to meet you.
You too.
Abe, always good to see you.
Yes, thank you, Jeff.
And we will wish you the best of luck on these upcoming days here on the 28th and 29th.
Wonderful.
Thank you so much.
Thank you.
Appreciate the
Thank
time.
you.